Maureen Womack, API, thank you for joining us for this conversation. I think one valuable place for us to start off in this conversation is just to really kind of delineate between the organizations we've been speaking with so far really are on, they're not on the behavioral health side, but you are on the behavioral health side. Can you just share some of your thoughts about the differences between behavioral health and more like the medical side of health?
You know, that's an interesting question because there are differences, but there should not be.
Ah, okay.
And the reason I say that is that you cannot have overall health care without behavioral health. We know how much our mental state affects our health outcomes. We know how it impacts cardiovascular disease. We know how stress impacts diabetes, obesity. And so to really kind of try to keep them separate no longer makes sense. But they are separate. And so, for example, we have freestanding behavioral health care.
Right.
And we have med-surg health care. And so in behavioral health care, we're still trying to fight with parity on the med-surg side, for example.
Sure.
You know, and so there's the distinctions where they're still separated. We operate differently. Some of our regulations are different. You know, training's different. And yet they're still so integrated in terms of the patient and holistic health.
Yeah, absolutely. The patient is the center point, but it sounds like there's a really strong wall in between these two universes, yeah?
Strong wall. You know, and even in the perception of consumers and patients, I mean, patients really still have this kind of fear about behavioral health.
Yeah.
There's still that stigma that's
Stigma's
related
the word I was
to
thinking,
it.
yeah.
You know, fortunately, I think the pandemic has really made people more comfortable in realizing that, you know, behavioral health is essential. We've never seen such rates of anxiety and depression, you know, isolation among our elderly.
Yeah.
And we're beginning to see how that's impacting overall health.
So as you start to see more and more how these aspects of mental health are impacting the big picture of health, has there been a shift in terms of how this sector of healthcare is approaching innovation or is innovating around care? What would you say about that?
So I think we're kind of on the cusp of some new discoveries. We're beginning to look at, you know, how can we do some preventive work in terms of behavioral health?
Yeah, sure.
You know, looking at the prodrome stage of mental illness and seeing if we can prevent them from going into full-blown mental illnesses.
Yeah.
For example, we're really looking at new medications. I mean, who would have thought that magic mushrooms, for example,
Sure.
would have such an impact in treating of depression and other illnesses? We're looking at transmagnetic simulation and other techniques where we can really begin to look at the brain and alter the brain and some of the brain capacities. And then genetics.
Yeah.
And really looking at kind of precision medicine and looking at what antidepressant specifically is for that person based on their genetics.
Wow.
And so getting a much more precise in terms of medications, much more precise in terms of treatment, and also really kind of going upstream and looking at some of the prodrome and preventative sides of behavioral health.
Yeah, I think about, you know, like really looking into like pre-diabetes as a state that creates an opportunity to be very preventative, where states can certainly deteriorate, get much, much worse. It sounds like the mental health side also focusing on preventative. Here's a note I've hit a few times in this series before, certainly. The question is, it's been largely regarded in the U.S. health system that it's behind in terms of innovation. You think about many other sectors and then compare that to American healthcare. People have said anywhere between 5 and 20 years behind, just generally hand-waving that. I'd be curious to hear from you if you feel like there's a difference between how far behind med-surg is versus how far behind mental health is.
I think that probably behavioral health is actually further behind med-surg.
Okay.
You know, if you think about it, it's only been like in the last 15 years that we recognize that people with mental illness are dying 25 years younger than the population as a whole.
Wow.
You know, and that's evidence, though, that we knew about probably 25 years ago.
Yeah.
But it's just now becoming kind of in the forefront. You know, we've never really kind of looked at how we can do, you know, precision medicine in behavioral health. You know, so they're saying in behavioral health, it's 25 years from science to service, which means it takes 25 years
Oh, sure, yeah.
for us to have a scientific breakthrough or to know something about mental illness before we actually get it into practice.
Wow.
And that's just not acceptable.
So I hear you say that's not acceptable. That's an energy, right? The energy of we have to change this.
Right.
Is that energy starting to become prevalent? Are there pockets of organizations and people who are like, look, we need to change this. This 25 years needs to be 20, 15, 5. Are there emerging pockets? What's it looking like? What's the landscape of that energy looking like?
So I think it's really being driven on multiple fronts. I think consumers, patients, are really saying, this is not acceptable.
Sure, yeah.
You know, there's a booth out there that's talking about early diagnosis or even pre-diagnosis of cancer. People want to know that.
Yeah.
You know, and so I think consumers are a big factor. I think academic medicine is a big factor.
Yeah,
So as we're really looking at, you know, academic medicine, they're into research, but they're also training physicians.
Yeah.
And so those two really are coming together and saying, look, as you're teaching our up-and-coming medical professionals, teach them the science at the same time. Because they're the ones going into the community that are going to be practicing medicine. And so I think academic medicine is also pushing it. And then I think medical professionals are really driving it, saying, our patients deserve better.
Yeah. What's interesting is you talk about that there certainly is a stigma, right? There's like, oh, mental health, and I don't want to be a person who's in that system, right? There's that piece.
Right.
And then as you talked about some of the academic research, I think you mentioned there's the psilocybin research stuff that's happening. I think that's Johns Hopkins University is driving a lot of that. And there's a double stigma, right? That's making it even more challenging to make progress in those ways. How do you, as a industry, how do you work to find people who are willing to break through those challenges, willing to kind of overcome those stigmas and drive innovation? How do you find innovative people? How do you attract innovative people?
So I think in a couple of ways, you know. So first we start with some consumers who are pretty innovative and willing to speak up. And I think we've just seen recently some people from Hollywood. You know, I'm come from California.
Sure.
You know, they're really becoming a voice of people who suffer from mental illness.
Yeah.
They're also usually pretty progressive, and so they're saying, look, if this works, if psilocybin works, then we need to try it. We need to try ketamine, you know, and they're kind of taking the stigma away from saying you have a mental illness because they're the voice now saying, I have this.
I see.
You're going to see it in athletes. Athletes are starting to speak up.
Yeah.
And talking about how behavioral health really affects their performance. And so we've got people who are really talking about mental health and then saying we, you know, who suffer from mental health issues deserve to have the latest in terms of treatments.
Yeah.
We're also just beginning, and I think where stigma is really strong is in the health profession.
Oh, sure.
I mean, physicians don't want to say they suffer from a mental illness.
Sure, but now burnout's everywhere, right?
But now burnout is everywhere.
Yeah.
And so it's becoming where even medical professionals are beginning to be more comfortable in saying, you know, I'm depressed. You know, I need to do something because it's impacting my patient care. I'm a good physician.
Yeah.
You know, and so even as the medical field is becoming more comfortable and embracing it, we're seeing changes in terms of reducing the stigma.
Yeah.
But it's still alive and well. I mean, ask any hospital if you have two equally qualified physicians and one says, I have a history of depression, the other one doesn't admit it, who are you going to hire?
Right.
That's the reality.
That's a challenging reality for sure.
That is the challenging reality.
So as you deal with this, there's so many obstacles, right? It's like every time we have someone in this chair, we hear about a lot of obstacles. And we talked about attracting people. Let's talk about, for a second, setting up the environment, right? So you can attract people, and what you're saying about the voices coming from Hollywood and athletes and now physicians, bringing attention. People go, look, that's a problem. I want to be a part of solving that problem. So now you're attracting the people. How do you set up the environment, the organizations, like let's say internal of your own organization? How do you set it up so that innovation can thrive?
So one of the things we really do emphasize is becoming more of a learning culture and an educational society. You know, so in our healthcare system, we are APA approved to train psychologists. The state of California just gave us a grant for $2.5 million to start a residency program for psychiatrists.
Great.
And so I think any time that you can really stimulate people's curiosity and you can really kind of bring academics into your environment, then I think you can attract and retain people because
Wow,
people
that's
are
good.
naturally curious.
Yes.
We want to learn.
Yeah.
We want to know we're doing the best we can possibly do if we go into our fields.
Yeah, it sounds like what you're saying, allowing that natural human curiosity to be a driver
It is.
in the environment. And I imagine there's some element of making it safe to explore those spaces, maybe even safe to fail. Can you tell me a bit about like making it safe to innovate?
So we have what's called the just culture. And that just culture is basically saying it's okay to make a mistake. What we need to figure out is what was the cause of that mistake? Because actually in healthcare systems, it's very seldom an individual who made a mistake wantonly.
Sure.
So it's a system failure. So if you're going to really stimulate innovation in science, you're going to make mistakes. That's how science is formed, is through the process of trial and error.
Yeah.
And so by saying, if we make an error with healthcare in the delivery of it, speak up, learn from it, fix it. You know, it's usually a systems issue.
Yeah.
And so it's the same thing in innovation. You start out by saying, you're going to fail. That's an expectation.
I like that. I like that a lot. So let me ask you this. It seems like there's a rapid increase in the specialization that's required in these little segments of healthcare. Visiquate, a great example, specialization in analytics, right?
Yes.
And then every other vendor in this room has a specialization because it's going a mile deep, right? And for an individual health system to possess internally all these strengths is becoming more and more challenging. So it looks like there's this requirement to partner with the people who are going a mile deep in these highly specialized areas. Do you have guidance for health system leaders in terms of how you have engaged vendors in this space to bring in and cover those gaps that may exist? What advice do you have for health system leaders?
You know, there's no way we can be an expert in everything. It's just not possible. And so there are people that have expertise that can really enhance what you do. And so we've looked at some of the software that is out there, things from like Simpler. You know, I was just meeting with a human resource vendor that was talking about how they can do data analytics or predictive analytics to determine who's beginning to disengage from the workforce and identify that person so you can go and meet with them and re-engage them. You know, and I thought, what a beautiful addition to healthcare. That's really cool. Is meet them before that, you know. Looking at predictive analytics of who are going to be the high utilizers of services.
Yes.
And trying to intervene before they become that high utilizer of services, you know.
And as you look to engage, let's say either one of those two types of solutions, how do you, what steps can you take to ensure success, right? Or to prevent failure as you look to engage a third party, to partner in an innovation, to move your health system forward? Do you have guidance for health system leaders in that regard?
I think the first thing you really have to do is to explain why you're partnering with these to your workforce.
Sure.
Because, you know, there's always that kind of suspect, and looking at what is the return on the investment, because right now, you know, we know dollars in healthcare are very limited, and it's like, well, do we really need this? Is it going to bring us any value, or are we just spending money that could go into raises or bonuses? Yeah. And so you have to really be transparent. You have to really explain to them why you're doing this and how it's going to benefit them. Yeah. You know, and all of that socialization has to occur before you even bring in a new vendor. Yes, sure. And then you've really got the vendor, you know, where you both have to really kind of speak the same language and speak to the same mission and speak to the same reason and the same why. Yeah. So the next question I want to ask you, it can either be general to behavioral health or it can be specific to your own organization. What's the next area of innovation that you think really needs focus? In terms of behavioral health, I think that we really have to begin to identify earlier on in that prodrome stage those individuals who are at risk for a serious mental illness. Sure. Because it is a painful illness for those, you know, particularly with the schizophrenias, you know, and the psychotic disorders. It's life-altering. And if we can find the genetics and we can work on it before they actually have psychotic episodes, these people can go on to lead normal lives. And so that's really an area we've got to look at, is the genetics and understand more the genetic underpinnings of psychiatric illnesses.
So in that direction, what have you seen that's exciting? What's coming that you're either investing in and looking at, or you just have recently identified as an area that's really interesting and engaging to you?
So, for example, when I was working in Virginia,
Yeah.
Eastern Virginia Medical School was looking at the frontal lobes and the size of lobes of the brain at the time that children were born, and being able to kind of predict whether or not that individual, based on some of the morphology of the brain, may be suspect to a mental illness.
Wow.
You know, looking at our telomeres and the lengths and seeing if there's any kind of connection or correlation between that and genetics and those people who are predisposed to a psychiatric illness or substance use disorder.
Yeah.
You know, so that we can start moving the science more upstream.
Wow. So I'm also curious because this is a CEO CFO conference, so I want to ask a bit about on the revenue cycle side, the financial side. Are there specific challenges in the behavioral health sector that relate to the financial side, the revenue cycle side?
So there are challenges, and this is probably something you may have regret to bring up because you're going to get me on my soapbox. So we still don't have parity in mental health on the revenue cycle.
Yes.
And that is really an angst when we know that behavioral health is real and it affects the health outcomes, that we don't have parity is so challenging. You look at electronic health records and they're still all being developed for med-surg issues. There's very little out there that's truly devoted to psychiatry or to integrated care. You know, and so coding becomes more difficult. You know, looking at our case weights becomes more difficult.
Tools aren't there.
The tools just aren't there. And so the resources aren't being designed for behavioral health yet. And it's a problem.
Right. I'm going to assume that if you pull the thread on that, you have to get all the way back to because the money isn't there. Is that where it's at?
The money isn't there, or for a long time, behavioral health was really kind of a neglected field.
Sure.
You know, so there wasn't the money in behavioral health, to what your point, and so why invest in it?
Yeah, that makes sense.
I think it will change now because of the pandemic. I think we're coming into our own as a science and a service line.
You're feeling positive about it.
I'm feeling very positive about
That's great. So I want to ask you, again, because we're really trying to help other health system leaders get information that they can use to succeed in their own right. Can you tell me about an instance maybe of trying to innovate that you encountered a challenge, and then what did you do with that challenge?
So one of the first things we tried to do is to really start placing behavioral health therapists in primary care offices.
Sure, yeah.
And, you know, you would have thought that would be so simple.
I was just thinking that, yes.
There was such resistance from the primary care providers.
Wow.
I remember some of them saying, okay, so we've screened and this person has depression, you know, and then we found out that they're suicidal. Now what do you want me to do? I was better off not knowing.
Sure.
I'm like, were you really? Were you really better off not knowing?
Yeah.
Because this person has cardiovascular disease. They're overweight because they're depressed.
Right.
Because they're not being active.
Yes.
And so how is it that you're better off not knowing?
Yeah.
But really kind of that resistance, and I think it's because of the discomfort of identifying that this person has this illness, and then what are we supposed to do about it?
Yeah.
You know? And so that was a surprise to me, is that there's still resistance in mainstream medicine or med-surg medicine to bring behavioral health in.
Do you know what I'm hearing in that is like there's this discomfort in finding problems that you don't know what to do about in the med-surg side, where it seems like the mental health side is more comfortable finding problems that you don't yet know what to do about and are willing to dive into that space. It seems like that discipline or that capacity would be really valuable on the med-surg side as well. How can we get more of that type of thinking to the med-surg side?
Right, and see it as opportunity.
Yeah.
Instead of, now I have to do something.
Yeah.
You know, and so I think there are kind of lessons learned just in the culture of the delivery of care.
Yes.
That we can learn from the med-surg side. We can learn how to be better at revenue cycle. We can learn how to be more efficient. We can learn how to see more patients.
Yeah.
But we can also teach them that kind of openness and that curiosity and see that, if there's something going on with that patient, it's an opportunity to help that patient become better.
Uh-huh. Wow. Great. So tell me about what's the next initiative on the calendar for you guys?
So our next big initiative is to open our psychiatric residency program.
Okay.
Which will be a great opportunity because that puts us in with full academic medicine.
Yes.
Where we'll be able to start doing some research. We'll be able to train the next generation of physicians.
Yeah.
Hopefully we can stabilize our workforce issues.
Sure.
Because some of these psychiatrists are going to want to stay and work with us.
Yeah.
And so that really is our next big initiative.
And to get into the academic side, as far as research goes, is there a specific area of research you guys are hoping to start with?
I think we're really wanting to look at more of the underpinnings of depression because it's so prevalent right now.
Yeah.
And really fully understanding the impact it has on comorbidity.
Sure. Yeah, and have you guys really been able to establish very, very clear relationships between depression and comorbidities? Are those relationships super well understood?
Yes.
Wow. Yeah, well then let's get into that, huh?
Right.
Yeah, it sounds like we've been addressing symptoms, not problems.
We've been addressing symptoms and not people.
Well said. Yeah, well said.
And I think that's been the issue.
Let me just ask, is there anything on the, I don't want to open this up, but obviously today's the midterms, is there something on the political side that you think would be meaningful to help move things along in the direction that you're talking about?
So I think to kind of move things along will be kind of more emphasis in terms of healthcare.
Yeah.
I think we've got to look at some of the regulations in terms of healthcare and
Yes.
see, are they really helpful?
Yes.
Look what we did during the pandemic, how fast we got a vaccine approved.
Right.
I
Yes.
mean, so we can do it, but
Yeah.
what's standing in our way?
Yeah.
A lot of times it's regulations.
Yeah.
Behavioral health is extremely overregulated, and you look at all the documentation requirements, and you really have to start asking yourself, are they purposeful? Is there really something that we're getting from this?
Yeah.
And so I think that's really where we need to start looking at our government and our legislator and our public officials to start addressing. Are you helping healthcare or are you an impediment to healthcare? And if
Right.
you're an impediment, then do something about it.
Yeah. I had such a hopeful moment, right? We had so many things about healthcare that we just, I guess, collectively understood were things that took 2 years, 3 years to do. And then the pandemic came through and they were done in a month. It's like, oh my goodness, we can do things very quickly. But I don't know, I want to ask if you feel the same way, that it seems like we're trying to settle back into, things take 3 years. What's your thought about it?
I think we're trying to settle back, but I think there's enough momentum from the field that we're not going to be able to settle back.
Yeah.
I had this opportunity to listen to the chief scientist from the World Health Organization.
Yeah.
And he was speaking with this enthusiasm, excitement, saying, we put together teams from countries all across the world. So the United States would be teamed with Belgium, and they would be teamed with other countries. And we funded research. And in less than a year, with this global cooperation,
Yeah.
we found a vaccine.
Yeah.
Think if we harnessed the knowledge
Yeah.
and the energy and the enthusiasm, not only from the United States, but globally,
Yeah.
what we can do in terms of making progress in healthcare.
Yeah. So I guess that we have time for, I think, one more question perhaps. I want to ask you, if you had a quorum with health system leaders that were on the med-surg side, and you had a message you could share with them, your thought about how to move this forward, right? How to create this partnership between mental health and med-surg side. What would your message be to those leaders?
I think I would tell them that we're your best friend.
Mm-hmm.
We can really help you drive better health outcomes,
Yeah.
greater patient satisfaction, a better patient experience.
Yeah.
And we can also make your life easier because even though you may not know about depression, you're having to deal with it.
Right?
So why not look to us as subject matter experts to deal with the depression that's keeping that patient from adhering to their medications,
Yeah.
from doing the exercise that they need to do for behavioral activation,
Yeah.
and get that patient to have the best possible health outcome.
Wow.
So look at us as your friend and your partner.
I really hope you have an opportunity to share that message, but because that was so good, I would love to hear if you actually had also a message for individuals, people who, like may be dealing with mental health. There is that stigma. What's your message for them?
Is to understand that this is something that you didn't ask for, and it's not something you should be ashamed of. And if you're having any of those symptoms, then you need to tell your physician.
Yeah.
And tell them so that you can be treated as a person, your whole person, so that you can become as healthy as possible.
Yeah.
So speak up.
Are you speaking here this week? Are you actually on any of the stages? Are you talking?
I am a speaker here
Great.
at the conference.
It's just like that's so good because you have such an important message to share. I really appreciate you coming to speak
I
with
really
us.
appreciate
Thank you
talking
so much.
with you.
What a great
Thank you so
conversation
much.
with you. Thank you.
Okay, I enjoyed it very much.
Right
I
on.
really did.
Great.